You see, this issue of interoperability and health information exchange is far from simple. In fact, the ONC has just released and finalized, or in the midst of finalizing, a 10-year plan for interoperability, because I know we around the table, and many of us, many initiatives that are going on by payers, by individual organizations, medical groups trying to promote interoperability to address specific needs within a health plan, within an ACO, within a medical group or region, within a pilot program. All of us face the same consternation. We don't know where to go, and we don't know when we can make that interoperability a reality. But I think what we see here is the foundation for what is to come, and in the time frame of ONC. It's a 10-year plan. It's a 10-year plan for achieving interoperability based on trust, based on a shared set of standards, as Antonio addressed, and based on engagement. And this type of engagement is really what we need moving forward. And I want to thank Antonio for being at the helm of making this project, lending it continuity, and to the government of Puerto Rico for continuing to support it, even after the first phase of ONC funding lapsed. Our next presentation is by Dr. Wanda Velez Andujar. Dr. Andujar is the president of the Puerto Rico Medical Association, a centenarian, 112-year-old organization that precedes many of our own organizations. They must be doing something right when they have reached the stage of being a centenarian organization. So thank you. And welcome.
Thank you, Senor Fernandez. Good morning to everybody, and I must thank the Chamber of Commerce for inviting Puerto Rico Medical Association, which, as he says, was founded a year before UPR was founded, okay? So after these excellent presentations, I'm kind of shy, what should I say? But I will take you directly to the electronic records. How many of you know medical electronic records? Do all of you know what we're going to be speaking of? Well, I presume then I will be able to explain a little, to describe briefly what an electronic record is. We have two kinds of records: the medical record, which is the one that the physician uses at his office, at his facility. The health electronic record will be the one that we will be able to share with other institutions, with hospitals, with states, and eventually with the other countries and the whole world. In that record, we have on our monitor simultaneously exposed all the demographics of the patient, his age, his or her, of course, if the mother is married or not. While you're looking at the patient and grasping what are the complaints and having the history taken, you can take a look to know how many times has the patient come for the same reason, how many times, how often does the mother comes, if the father does come. A lot of information from the very minute the patient gets to the office. The secretary will get the information of the insurance card. The triage will have the history, the complete history of how, me as a pediatrician, how the patient has been gaining weight, height, etc. Then you have the opportunity to write down what you have asked in the history, which for me is the part that most physicians are not very happy with. For my age, and for those a little older than mine, if they didn't have the opportunity earlier on to get how to write in a typewriter machine of those years in the past century, then to write now on the computer and look at the patient, it's very hard for them. That's why so many physicians have not enrolled themselves for the electronic health record and have even closed their offices, which goes against their own finances, excuse me, because then the office is not updated. So once you overcome that inconvenience of learning how to write down on your typewriter. You do improve, thank you. You do improve the meaningful use of the electronic health record, and this makes a very excellent opportunity to really be understood and to improve the communication with the other physicians and with everybody in the office. Because as you most likely know, we are well known for writing very badly, for writing too fast, and for not being legible of what we write. Which eventually will traduce itself in a poor prescription if we are not very careful, and in a wrong medication that the drug pharmacy will be giving the patient. Since I'm supposed to let you know how we are doing in Puerto Rico, I must say that we presume our number of physicians actively working today are 10,000 plus. And taking that into consideration and adding the dentists, the number that already have chosen to use the electronic records are 4,921. So close to 5,000, so it'll be close to the 50%. The physicians that already received federal incentives are only 2,594, of which 256 were granted through Medicare and 2,328 through Medicaid. The significant users in compliance with CNEs, as you already learned what that means, are 1,367. And the physicians and dentists that are already using e-prescribing are up to February 2015 are 2,678. As you can see, it's presented. We're sharing this information. The Regional Extension Center at Puerto School of Medicine was so kind to share with us. This first graph will show you the very first year, 2011, how through January it was not even 250 and didn't reach 1,000. Then the red graph goes for 2012, yellow for 2013, and the green is for 2015. So we can see that when January arrived in this year, we are already up close to the 2,500. Going to the next slide. This is the monthly active providers. It has been addressed again through the same year. So from here to December, November 2011, that comes here to 2012, and so forth. It shows how it has been growing up in a very straight line to many more people using it. When we go to this graph, it goes for quarterly average active physicians. And so this purple, I say purple, I don't know if everybody, the first quarter doesn't reach the 250, second quarter of the same year, which is 2011, and at the end of the 2011, it still doesn't reach 1,000. So now for the first quarter of the 2014, we have been growing, and it's close to the 2,750, so we still need a lot more to go. This goes for the total monthly e-prescribing. The prescriptions through the electronic health records are many more. I'm sorry, I shouldn't have said it that way. Are many more than the physicians, of course. And another advantage is that for each medication you prescribe, you will do only one prescription. When I used to write them on a pad, I will write 2, 3, I will make a groceries list, 1, 2, now it will be one medication per prescription, so it will be easier again, besides the writing, for the pharmacist to read what we are writing. So as you can see here, it goes all the way up again in a straight line. And this is my last slide, I think. So we have that for the e-prescription, we have been also growing up to the fourth quarter of the 2014. So this is what we're really having from February 2015. the total year in prescription, as you can see, because we must remember that at the beginning the law in Puerto Rico had to be changed because we were not allowed to send through email or only through fax the prescriptions to the drugstore. So as you can see, it's 2008, 9, and then in 2010 it starts with 128,000, keeps on growing, and in 2014 we go up to 8,112,000 prescriptions a year. I must show you, as you can see, this is what we are giving now to our patients. This is what many times the poor patient will give to the pharmacist at the drugstore. A paper that, if that lost, was kind of dirty, etc. So, I have been very brief. I hope I did get my message through, and thank you for your attention.